Greetings and welcome to the March 9th Community Update. My name is Stacy Wood and I'm the Public Information Officer here in Buncombe County Health and Human Services. Today, Stacy Saunders, Buncombe County Public Health Director, will be providing a situation update on COVID-19 here in our county. You can view this community update in Spanish on the Buncombe County Health and Human Services Facebook page, and that can be found on Facebook at BCHHS. Now let's go ahead and get started with an update from Stacy Saunders.
Good afternoon, everyone, and thank you for joining us today as we update you on the current COVID-19 trends and vaccine rollout. Let's start with our latest indicators. As of today, 15,822 confirmed COVID-19 cases have been identified in Buncombe County since the pandemic start. 293 COVID-related deaths have occurred in our community. This indicator has been stable for 7 days with no new deaths occurring in that time. Our new cases per 100,000 per week is 98. This indicator has fallen to under 100 new cases per 100,000 per week, a value that we have not seen since pre-surge days. And currently we are seeing about 37 new cases per day enter our public health workflow. Also now more similar to pre-surge values. Our percent positivity is currently 3.1%. This indicator has decreased slightly since last week and overall has remained stable for about a week. Our hospital indicators remain stable and favorable. These indicators are looking more and more like the metrics prior to the holiday surge. This is encouraging and a welcome sight after a season of very high sustained transmission and spread. I want to see these trends continue to move further down. And to do that, we need your continued help. You are likely aware the CDC released new guidance regarding fully vaccinated people. Fully vaccinated people are those who have received the complete series of a vaccine, 2 doses for Pfizer and Moderna, and 1 dose for Johnson & Johnson, and are 2 weeks out from their last dose. The new guidance states that fully vaccinated people, again, those 2 weeks after their final dose in their vaccine series, can visit other vaccinated people in small groups indoors without a mask or physical distancing, and can visit indoors with unvaccinated people from a single household without a mask if the unvaccinated people are at low risk for severe illness. This doesn't mean that if you are fully vaccinated, you can interact with the general public without a mask or social distancing. This guidance only applies to certain situations, and North Carolina executive orders still require masks, social distancing, and other precaution measures for other interactions outside the household. Please remember, if you are fully vaccinated, most of the population still is not. Continue to follow the preventive measures in order to reduce risk. Please help keep our indicators heading in the right direction and help us continue to stop the spread of COVID-19. Continue to wear your mask, keep your distance, wash your hands, and limit your interactions with those outside your household. If we do our part now, we can see our trends remain stable, if not continue to decline. These simple steps are so important as we continue to vaccinate the community. Buncombe County HHS will open the waitlist to Group 3 frontline essential workers tomorrow, March 10th. Those eligible can access the waitlist at 8 a.m. on Wednesday by visiting buncombeready.org or calling 828-250-5000. Individuals who are working in person in one of the 8 essential sectors are eligible for vaccinations. The 8 essential sectors are critical manufacturing, education, essential goods, food and agriculture, government and community services, healthcare and public health, public safety, and transportation. For more details on these sectors and other vaccine information, please visit covid19.ncdhhs.gov. Group 3 frontline essential workers will join Groups 1 and 2, healthcare workers and individuals 65 years and older, as eligible for vaccination by Buncombe County HHS. If you are unsure in which vaccination prioritization group you fall, please visit findmygroup.nc.gov to determine your group. As of yesterday, almost 66,300 total vaccines have been administered in Buncombe County amongst all approved vaccine providers. About 63% of these are first doses. Buncombe County HHS and our partners in emergency services have administered 38,146 total doses since beginning December 22nd. Almost 24,000 of these are first doses, and about 14,150 are second doses. For the last 3 weeks, we have received a baseline allocation of 2,340 doses. In addition, for the last 3 weeks, we have received 300 additional doses each week for equity projects. North Carolina DHHS allocated equity bumps for the purposes of improving the equitable distribution of vaccine to marginalized populations. With the equity allocations, Buncombe County HHS has worked with community partners like Tridestone Missionary Baptist Church and Haywood Street Congregation to hold events to reach populations that may have limited access to vaccination opportunities, but may be the highest risk for severe illness if they were to contract COVID-19. This week, in addition to our baseline and our equity allocation, we have accepted a transfer from our hospital partner of 1,000 doses of Johnson & Johnson for waitlist appointments. This is truly exciting. With the EUA approval of Johnson & Johnson, we now have 3 highly effective vaccines available in North Carolina and in Buncombe County. If you are wondering about which vaccine is best for you, I'll keep it simple. With all 3 vaccines being safe and effective, the best vaccine for you is the one available to you at your appointment. We are currently scheduling in the 25,000 to 28,000 range of the wait list. We continue to run our first dose operations from the AB Tech site with our baseline first dose allocations. Additionally, we continue to provide second doses at our Reynolds High School site. We've made some improvements to the wait list that include email verification, immediate notification of waitlist number and confirmation, and the ability to unsubscribe from the wait list, allowing folks to remove themselves from the wait list. If you have received your vaccine elsewhere and would like to be removed from our Buncombe County wait list, you can still call us too. Please call 828-419-0095 to inform a team member that you would like to be removed from the wait list. We continue to hear from some folks that they are able to get their first doses at one of our other vaccine providers in the area. This is great news, as more vaccine providers like Walgreens and our partners at community health centers are added to our community. This increases the access and opportunity for vaccine distribution. We hope as supply increases, more and more providers will begin to receive vaccine allocations, and there will be more access to community members. Individuals can check out myspot.nc.gov to find a vaccine provider in your area. Please remember that you may receive your first dose at any location, and it is important for you to return to that provider for your second dose. All second doses are sent based on first dose allocation and administration. Your first dose provider will receive your second dose. It is important to remember, even with our trends continuing to decline, you may still be exposed to COVID-19. If you are having symptoms or believe you have been exposed to COVID-19, please seek out testing. We have several testing partners in our county, and you can find one near to you at Find My Testing Place website. Please remember that a new testing provider is available in our community through a partnership of Buncombe County HHS and North Carolina DHHS. Please visit starmed.care for more information and to register for a testing appointment if you are having symptoms of COVID or have been exposed. In summary, our trends are looking more and more like the pre-surge days. This is a welcome sight after several weeks of surging cases and rising community transmission. This month marks a year-long fight against COVID-19 as our state identified its first confirmed case a year ago last week. We here in Buncombe County are only a couple of weeks away from marking the first identified case in this community. While vaccine rollout is underway, it will still take a while for our state to receive sufficient amounts of vaccine for everyone. In order to continue the fight against COVID-19 and reduce the spread in Buncombe County, please continue to practice the 3 W's. This goes for folks who have been fortunate enough to receive vaccine. Though you have received your complete series, not everyone has. The overwhelming majority has not received vaccine yet. Please do not assume that because you have received your complete series that others have. I want you to actually assume that no one has and continue to wear your mask, limit your interactions, keep 6 feet apart, and wash your hands. Please do your part every day. Thank you so much for your time and attention. Take care and be safe.
In conclusion, thank you for your year-long engagement with the COVID-19 response in Buncombe County. Please continue to stay safe and practice the 3 W's. For more information on COVID-19 in Buncombe County, including testing and vaccination, please visit buncombeready.org. Thank you.